Come to order. This section of the Committee of Supply will now consider the estimates of the Department of Health, Seniors and Long-Term Care. Does the Honorable Minister have an opening statement? No. Does the critic from the official opposition have an opening statement? Member for Roblin.
Okay, thank you, Honorable Chairperson. And I just wanted to, of the largest department in government with a budget this year of over $10 billion. So I think the discussion we have here today is really important. The questions we ask here on behalf of the care that they need and value for that level of investment are important. That we address some of the issues that have been and how this budget proposes to address some of those issues. And I just also wanted to quickly thank the staff in the department. Some of work every day on behalf of Manitobans. Thank you to them. And with that, I look forward to getting into some questions.
Debate on the Minister's salary is the last item considered for a department in the Committee of Supply. Accordingly, we shall now defer consideration of line item 21.1 bracket A1. At this time, we invite the Minister's staff to join us at the table, and we ask that the Minister introduce the staff in attendance.
With by the best departmental staff in the entirety of government. These folks are absolute superstars, great people who care deeply about Manitobans and do a phenomenal job every day in their role of public service. So we've got to my left here, Deputy Minister of Health, Sil. We've got to his left, ADMs against the wall. Two more ADMs, Suzanne and JP. We've got Reina, who is my special advisor, and we've got Tino, who is my special assistant.
According to our Rule 77, bracket 15, during the consideration of departmental estimates, questioning for each department shall proceed in a global manner, with questions put separately on all resolutions that questioning has concluded. The floor is now open for questions. Member for Roblin.
Thank you, Honorable Chairperson. I'm going to start lays out some of the key initiatives the department is pursuing with respect to emergency rooms. And we know that emergency room wait times are certainly something I hear about from constituents on a regular basis. We know that the median emergency room wait time in Winnipeg has doubled under the current couple of questions about initiatives that are outlined on this page of the supplement. Under the heading, Advance the Lowering Emergency Room Wait Times Initiatives. Launched in April 2025 with implementation in June 2025. These efforts continue through 2026-27. And there's not a lot of detail there, so I'm just wondering if the minister changes were and what the impact has been, because I think emergency room wait times have actually only increased since those changes, whatever they were made.
seniors, and long-term care.
I appreciate that, Chair. Is it Honorable Chair? Is that your, yep, Honorable Chair. So I think it's important for us to talk about how we got the wait times. That context is really relevant because the context actually does help inform the work that needs to be done. So just give a largest emergency departments informs the reasons why we are ensuring that no emergency departments are closed under our government, like the 23 under the previous government emergency department. It informs the fact that we are opening the Eriksdale ED. It informs the approach that needs to be taken to address the result of the closure of those emergency departments. You know, the reality around ED wait times is that they are a consequence of us losing a trust and others were closed. What we've come to learn, and I would say the last year and in recent months, after some analysis, and there's more analysis that will be done, is that emergency departments being closed that was an issue was actually the fact that there was a lot of staffing and healthcare infrastructure that was also shuttered at those sites. So we're talking about related intensive care units, we're talking about specialty care access, we're talking about a workforce that is specialized and takes years to train and prepare to deliver those services. You know, highlight maybe in Northwest Winnipeg lost about 25% of their staffing infrastructure as a result of those ERs being closed by the previous government, the PC. Fortunately, the reality is that the pressures we're seeing in terms of emergency department wait times are correlated to that. They're a direct result of that and require a system to address those pressures that are caused by those closures and cuts. The other thing I think it's important for us to reflect on and to understand is that those closures and cuts of the aging, where the complexity of illness was increasing, comorbidities, and the realities of that here in Manitoba take a real toll on our healthcare system. And so during a time where we're now at about 1.5 million people in this province, you've got communities that are growing very, very quickly that themselves will be the size of small cities in no time. At a time where we should have seen stood up, more beds added to the healthcare system, more healthcare workers trained and hired, we saw capacity cut and diminished, which resulted in chaos in our healthcare system. Was able to finally have a look behind the curtain in terms of what was going on in healthcare. I was stunned to learn about additional cuts and decisions that having on the healthcare system. And we knew right away that there was a few key things we needed to do, and one of them is staffing, and that continues to be a top priority. We knew that in order to healthcare system, never mind change the trajectory to a better one, we had to stabilize, like essentially triage. We knew the healthcare system was hemorrhaging. We needed to stop the bleeding, one priority in order to do that. And so we have been able to thankfully recruit a net number of over 4,000 healthcare workers in our healthcare system. Existing, the remaining emergency departments that weren't closed by the previous government, working in urgent cares and other places. And I would say that staffing continues to be a top priority. Alone, where an emergency department was closed, lost 25% of their staff. And so this isn't just about reopening the emergency departments that were closed so that people have more options, so that we can to more appropriate places to expedite the care that folks are receiving and make sure it's more timely. We actually need the people on the front lines to deliver this care, and we didn't have, and I'll continue my answer next. Thank you.
Thank you, Minister. Member for Roblin.
Thank you, Honorable Chairperson. And you know, I asked a really specific question, Minister's own supplement. And I think it would have been fairly simple for the Minister to give a direct answer. And I have a lot of questions about this, and I guess the longer it takes to get the answer. You know, and the Minister spent 5 minutes blaming the previous PC government for problems that are occurring under their government. And nothing the Minister is saying explains why median ER for the entirety of the previous government. But since taking office, since the NDP took office, those wait times have now risen to 4.3 hours. They've doubled. And this has had real, we've seen, tragically, people have died waiting for care in ERs. Chad Giffen, Genevieve Price, Judy Burns, Stacey Ross, Luca Tang, a family with loved ones that died seeking care in emergency rooms. And I think they deserve more than a glib partisan answer from the minister. Growth, certainly that's a factor, but I think it would be a stretch to say that population growth has exploded so much within the last 2.5 years alone that it explains. The minister also talks about staffing. Certainly, incredibly important priority. But the minister and the X number of healthcare workers, but nobody knows where they are. And frontline healthcare workers have asked that question publicly. The head of the Manitoba Nurses Union has said that she has members on the front lines. And healthcare workers are unfortunately voting with their feet. They're leaving. They're graylisting hospitals in unprecedented ways, and that's something that this minister has poo-pooed in the past as just a union tactic that's deployed when the NDP are in power, which is really dismissive of the concerns put forward by frontline workers. A little more seriously, maybe some of those retention issues would be addressed. We also learned recently that Shared Health has no staffing plan. And while we're here to consider the estimates of is the biggest funder of Shared Health, and the department has oversight over Shared Health. And I think the fact that Shared Health doesn't know where staff are needed, how many, when, doesn't upcoming retirements, and what staffing needs are going to be going forward is deeply concerning for all Manitobans. Reducing access block at triage program, which I would have assumed is one of the lowering emergency room wait times initiatives that the minister would want to talk about. And the reason I'm asking about this program is because I have been speaking with frontline healthcare workers at major hospitals in Winnipeg who have concerns about this program and how it was rolled out. Of this program, how does it work? Where has it been implemented, and what have been the impacts of that?
Thank you, Member for Roblin.
Thank you so much, Honorable Chair. So as I was saying, our government has hired over 4,000 net new healthcare workers. And we recognize that, for years planning in place to identify, as the critic just said, actually, how many healthcare workers do we need to make sure that we're doing everything we can in our, whether it's our EDs, anywhere, quite frankly, in terms of our acute care system, and certainly in community as well. And that work wasn't done. And so as we're doing before, because that's a really important part of this conversation, we work across government. Healthcare is our top priority. And so we've been working, our department's been working very closely with the Department of Advanced Education and Training. Phenomenal minister who's done a great job of making sure that we are on the right path of training the number of healthcare workers that we need for the immediate and certainly for the future of this province. We're dealing with a system that was almost driven to the point of collapse. I heard that time and time and time again. I hear it now from healthcare workers who were saying that it was pretty clear to them the agenda, which we are seeing roll out in other conservative jurisdictions in Canada. The agenda was probably to privatize, increasingly so, rapidly so, healthcare, public healthcare, and then you turn to private healthcare as the solve, which we know isn't a solve that benefits people. It creates a two-tier system, unfortunately. So we've done the work of focusing on making sure that we're workers than we ever have before. We're retaining more healthcare workers, thankfully. We know there's a lot more work to do. We know that you can't replace, we're working hard at it. We've got almost 400 net new beds online, fully staffed beds. But we also know that we need more than that. We need much more than that. The 500 that were cut years prior to us, critical care beds that we've added in pediatric care and in adult care. That's a really good example. And we made those investments in partnership with nurses. It was nurses who told us that these beds were needed. This capacity was in order to make sure we're making smart investments for now and, of course, for the future. Now, we recognize that There's a whole lot more we need to do to address these challenges. You know, when you're talking about what's happening in the EDs, but you're really talking about what's happening throughout the rest of the system and even in the community, which is why we've been so focused on adding beds in key areas in the system. So beds, mental health beds, dialysis capacity, surgical beds. We've added all of this capacity in the healthcare system. We've added a ton of capacity now in community, and we're actually support every single site in being able to move folks through the healthcare system in a much more timely way, which if you can improve flow, reduce access block, you take those pressures off the emergency department to be moving more quickly than it is. But this is work that started under our government. So simultaneously, we're staffing, we're repairing and fixing a very, very damaged, near decimated health, implementing new initiatives and new resources and new strategies like extended hour primary care clinics to make sure people have better access to care and to bring those pressures down in the emergency departments. All of lifting, it takes time, but we are seeing, areas of improvement here. Manitoba now leads the country, went from being the worst to being the best jurisdiction in terms of access to primary care. Doctors, we know that over time, improved access to primary care means that people are going to be going to emergency departments less. But again, those outcomes and those improvements and those impacts take time to see. With it, we're going to keep rolling out initiatives and listening to experts locally, not only repairing the damage that was done, but also, again, implementing new ways of doing the work so that we can see improvements.
Thank you, Minister. Member for Oblin.
Thank you. And, certainly, the minister's provided me a segue to talk, which is, the importance of community care in reducing emergency room wait times. Certainly, this is a system-wide issue, but I am asking about some very specific things that are mentioned. I can't help but notice that the minister has utterly failed to answer either of the two questions I've asked so far about the Lowering Emergency Room Wait Times initiative launched by their government under that initiative and any results, because those are, we're not seeing results when it comes to ER wait times. We're seeing things, in fact, getting... I'll ask this question one more time before I move on. If the minister doesn't know or doesn't want to answer or wants to take it under advisement, that would be fine as well. I'm asking, what are the piloted changes mentioned in the supplement on page 33? And I'm asking the minister to explain the reducing access block at triage initiative that was mentioned when launched in May 2025.
Thank you, member.
Thank you, Honorable Chair. So there's some really wonderful people who we've been working with here in Manitoba, some phenomenal experts in emergency department care. Co-chaired this initiative, this table of experts to help guide the way that we would examine what's going on, what damage was caused to impacts of the closures and cuts to our ER capacity, and then how do we turn things in a different direction? What initiatives would make sense? And so I'm sure the made on this. I even made a social media video about one of the initiatives called the virtual ward. Again, I referenced extended hours primary care clinics as something that has made a huge to the emergency department or urgent cares for primary care. They can instead, they can use their now plastic or digital health cards, go to medinav.ca and book, in some cases, a same day or same hour. And so all of this work really is tied together in terms of the efforts that are being made to reduce those pressures while we add more beds and while we reopen emergency departments, put in plans in place for a more sustainable approach to healthcare moving forward. And I want to thank Dr. Olofsson, Dr. Ratana, Dr. Chachanov, all the folks, Heidi, all the folks supporting us launching and piloting initiatives like RABBIT. RABBIT, Reducing Access Blockage Triage. I can just explain coordination between a triage nurse, assigning triage, an acuity scale, so CTAS score, an ED doctor performing an initial screening, treatment, and testing. Models like RABBIT at staff beds and create triage protocols to jumpstart patients' initial assessment and treatment process. And so what we've seen is that, what we've seen, RABBIT and other initiatives have to go hand in hand with making sure that we're continuing to hire and train and retain staff. Like ultimately, that's the biggest piece that you want to implement has to be done in conjunction, of course, with staffing. And I mean, this is no surprise to us. We knew this for years in opposition. We knew it right away, training and retaining folks. The critic makes comments on the number of staff and where are they. I hope that she can understand that when she makes those comments, she's reflecting on the fact that healthcare workers, it's very clear we need even more. And we need even more because so many healthcare workers were cut and fired and lost their jobs or left the system under the previous government. And so, yeah, guess what? Not enough. There's a whole lot more healthcare workers we need across the board, and we're doing that work. And we're going to keep our foot on the gas because we recognize that an initiative like RABBIT needs more staff, including some work that we're doing in terms of the virtual ward, in terms of making sure that people have more access to community care. After years and years and years of home care not getting I hope that she can see that we're turning that around. It takes time, but we're doing the work.
Thank you, Minister. Member for Roblin.
Thank you, Honorable Chairperson. And I record that some of the concerns that were raised with me about RABBIT from frontline healthcare workers, physicians specifically, who expressed to me that if they were to be seeing patients in the waiting room but not actively treating them, and I hope that those concerns are being addressed, that it could be the case that patients would be moved from the waiting to be seen category to treatment in progress, changing the way patients are counted on paper without making a meaningful difference in their actual care experience in the ER. I'll leave it at that because I don't expect I'll get an answer if I were to ask a question about that. The minister spoke earlier about the system-wide approach that is necessary to reducing emergency access to primary care. It's also about increasing access to long-term care services. And in particular, I wanted to talk about home care because I was surprised the department's key initiatives with regard to primary, community, and seniors care. Home care is not mentioned. And that's deeply concerning, I think, because we know that without will end up stuck in hospital. They'll be on the ward in the hospital, unable to be discharged because home care services are not available. Or if they're in community already and aren't able to access the home care service. So I was just a little surprised to see that home care wasn't listed as a priority in this budget, given the direct impact that has on emergency room wait times. And we know that particularly with the decision to centralize home care scheduling services in downtown Winnipeg, And then there was, the minister walked that back publicly, I believe it was last September, caused by that decision to centralize, and said they were walking it back. But then this last March, there was a party held to celebrate the centralization, which Frontline Home Care, I think the word they used was trauma, that the centralization of home care in the WRHA was traumatic for them. And it was certainly, I would say, traumatic for home care clients as well. The results of that, which was thousands of canceled and missed visits, a different home care worker coming to one's home every day, which can be dementia. So I guess my question is why improvements to home care are not listed as one of the key initiatives. What exactly, what steps are being taken to address what I would call a home care crisis in the WRHA?
Thank you. Seniors and long-term care.
Yeah, so thank you, Honorable Chair. There is an increase in home care in the budget year over year. We do reference investing in home care on page 31. And I just want to cause us to be cognizant of the folks who are working really hard every day in our communities. An article about somebody in home care who went out of her way to, in the media, painted a particular way. I had no involvement in that party. I don't host those kinds of events typically. It was a local manager who wanted to put a space together to say it's important for us to be really cautious and mindful about how we talk about things without knowing all the information. People are working really hard. They care deeply for their team members. They care deeply, really affect people and hurt people when, maybe they try and do a nice thing and it misses the mark, and then it is construed in a way politically that's pretty harmful for them. So I would just ask her to maybe refrain from that manager who is awesome, cares deeply about home care, and is really committed to making sure that Manitobans get the care they need, and to making sure that her team has the support that they deserve. And I talk about the people on the front lines who are showing up every single day, navigating challenges and doing their best for Manitobans.
Thank you, Minister. Member for Roblin.
Question that remains unanswered is whether the centralization of home care services has in fact been walked back as was committed by the minister, or whether it's still in place. We're throwing a party to celebrate the anniversary of that centralization. That tells me that in fact home care scheduling services remain centralized in downtown Winnipeg, which would conscience on that topic. I just did a quick calculation, and the year-over-year increase to home care is minimal. The dollar commitment to home care is one thing. I think Manitobans expected to see it listed as a priority, recognizing that there need to be delivered. It needs to be more responsive to the needs of home care clients. I hear from them every week, no exaggeration. They call me from all over the province because they will understand that sometimes the role means that you're hearing from people. People aren't calling to tell me that the government's doing a good job. I'm the critic. They're calling to tell me to complain. The complaints I hear about home care are serious. I hear complaints about the consistency of visits. Some folks write to me to tell me that their home care visits are canceled. Up to 60 workers show up early when the client isn't there to receive them. Or some elderly female home care clients who have respectfully requested not to have male home care staff. It's the unreliability of the service, and that's not a reflection on the frontline staff delivering the care, because I hear from them too. Times to call into the central intake line, how they get home care assignments that have them driving here, there, and everywhere and don't make any sense. They talk about how they don't have time for breaks, how that it sometimes doesn't even allow for travel time between clients, how they're running back and forth from the office for supplies because that's now also their responsibility to pick up and deliver those supplies. The difficulty in doing that, particularly in the winter with icy sidewalks and falls and injuries that they've suffered as a result. I have to turn this into a question. my question to the minister will be, when will those concerns put forward by home be addressed? And more to the point, are home care scheduling services still centralized in downtown Winnipeg? Because when I speak to home care staff, the message they've relayed is that this is a done deal. We have to move forward with it, and it's not rolling back, which again would contradict the comments put on the record publicly, I guess is the question.
Thank you, Member for Roblin. Honorable Minister of Health, Seniors and Long-Term Care.
Thank you, Honorable Chair. I'm just waiting on a little bit of information here. Home care in Manitoba used to be the gold standard. Before PC government was the gold standard. It really led the country in terms of the program, how comprehensive it was, how it delivered care. It was really impressive. It was a template that other jurisdictions had in Manitoba. It was eroded, it was neglected, it was cut for years. And yet again, we find ourselves in this position as a government where we're doing the work to fix home care, fixing it fast enough. I can receive that, actually. I recognize that home care is an incredibly important service that is delivered to Manitobans across the province. Predominantly, the vast majority, 16,000, 17,000 appointments. I believe it. Is that a month or a day? 16, can you remind me the exact stat? It's enormous in terms of the appointments daily for as a government actually taken the step to intervene and make sure that we have experts, some wonderful people from our department stepped up and stepped in, and we're of engagement from government in many, many, many years, arguably decades maybe, and support to really understand how home care has evolved over the years, has exploded, but the investment for years lagged well behind that. So for clarity, I don't know what the member is referencing in terms of us not investing in home. Clearly outlined in the budget, we've got an over 8% increase, $42 million year-over-year increase in home care. It's significant. That is distributed to the SDOs and and et cetera for home care. So we're investing in home care. We're also working directly with home care. We've supported them in standing up committees that are entirely NRCs, folks who understand home care, have been a part of home care delivery for many years, and they are the ones who are directly informing the work that is being done and how things are moving forward. We've made sure that there's new, they've got some folks there now with skill sets that they didn't have for a very long time to really help improve the way the program operates, which is really wonderful. So again, these are very real challenges that we are dealing with in home care. We listened to healthcare workers, and so when they highlighted concerns, we took action to make sure that the approach in home care was one that made their lives easier, that we continue to listen to home care workers, I have regular conversations with folks who've worked in home care for 20 plus years. I want to thank those folks, you know who you are, for continuing to meet with me regularly. I hear from Manitobans who offer us their thoughts on their lived experiences with home care, and we factor that in too. It's really important for us to understand how everyday Manitobans are affected by what's going on in home care and then make necessary. We're going to keep doing the work of adding more capacity to home care, including more investments on top of the over $40 million we've invested over this last budget into this year's budget. It's not just playing catch up for us. We recognize these investments weren't happening for 2 terms of a previous government, and we know that there's a lot we have to do to repair it, but we're also thinking long term. How do we cut back in terms of what home care delivered under the previous administration? And now we're talking about, okay, how do we build up more staffing capacity, and how do we add back some of those services that were eliminated that Manitoba in their homes, aging with dignity in their communities? And that also plays a role in reducing folks having to go or ending up in emergency departments or urgent care. So this is a really important part of the overall conversation around Manitobans in aging with dignity in their communities in Manitoba.
Thank you, Minister. Member for Roblin.
Thank you. Continuing in the, I did want to talk a little bit about personal care homes and some of the challenges that the long-term care sector has been experiencing as a result of and increasing costs, which is something that all Manitobans are dealing with, but certainly long-term care homes are experiencing that as well. A specific concern that's been raised that I've spoken with. Well, I'll back up a little bit. So, following the tragedy at Maples, during COVID, there was a report implemented to help address the recommendations of that report. And as part of that, there was funding allocated to personal care homes that I understand was to help move staffing levels up to 4.1 hours per resident day and to help implement new PCH standards. Now, the first 2 phases, and my understanding, based on speaking with operators, is that funding has now stopped. So I'm just wondering if the minister can and explain why what at the time the operators refer to it as the Stevenson funding stopped flowing under the current government.
Honourable Minister of Health, Seniors and Long-Term Care.
Care details, because I think it's really important. So, I explained to the critic how much we've increased funding under our government for home care specifically. But I think it's important when I reference what happened under the previous partisan, what I'm doing is I'm explaining how we got to the conditions in healthcare that we're dealing with today. And that really matters. And how we got to the conditions that we're dealing with today in home care, where we can see the previous government in some years, in many years, 1% increases, which not even to inflation, to de facto cut. We see in actually the 0.3%. The year after that, actually another cut of 0.1%, 0.3% after that. I mean, now we're in COVID years to home care, because that's what this is. These are de facto cuts that happen. Under our government, we see almost 6%. We see 20 preference in terms of $42 million. And our last budget was $87 million in home care. So the bottom line here is that the previous government, they cut the services, they cut home care, they didn't give any increases, they couldn't hire any staff, they couldn't improve care for Manitobans, and now we're in a position where we're cleaning that up, we're repairing that damage. In black and white, they speak for themselves, and I think it's important for us to understand that. Now, in terms of the path forward, again, we're going to keep investing in home care, the same with long-term care. We saw a net loss in long-term care of over 200 beds. I actually represent the constituency. We're in Union Station right now, where Park View 100 beds. I have friends. One of now has passed away. She's a wonderful two-spirit elder who lived there, could no longer live there when it was closed. And, you know, that closed communities in a long-term care capacity in Manitoba. They also, made a point of losing and cutting the housing that seniors depended on. Again, in my community, actually. Think about Lions allowed to be sold off to a private company. Countless seniors, I see those seniors at least 3 or 4 times a year, were affected and continue to be affected by that. So when we're talking about long-term care, real investments in long-term care, we're building, she knows this, she can go and see some of the sites that are well underway under our government. We're actually building personal care homes, not just announcing, investing again in making sure that we can staff our healthcare system and people's homes in a much more dignified and responsible way. So the Stevenson report, which was a direct result, happened at Maples and other personal care homes during COVID, where we saw the previous government fail to invest in protecting seniors. We've ensured that all of those recommendations from the report continue to be fast, making sure that our long-term care homes can move toward that 4.1 hours per resident per day in terms of direct care. And we will continue to do that. Recognize that we're coming into an environment where we lost a lot of capacity. A net loss of over 200 personal care home beds is enormous, particularly in a province the size of Manitoba. But we are not adding frontline staff to these personal care homes. We are investing in long-term care. We just invested an additional $5 million so that the food and nutrition is better in long-term care homes, so folks can have a better quality of life, so that folks have a transitional, appropriate place to get care, get support while they wait for that more appropriate long-term bed. So I think the number of beds we've added between Winnipeg and the Interlake, with more on the way. So, this is something that is close to heart for me because I live in a community, I represent a community where we lost hundreds of.
Thank you, Minister. Minister was using a document. Can they confirm it was private or public document, please? Minister for Health, Seniors, and Long-Term Care.
But we can put that together and provide it at a later time. We'll provide it. Okay. Thanks.
Thank you, Minister. Member for Roblin.
Thank you. And, I have to say I'm a little vociferously for Parkview Place. It was a private personal care home. It was the site of one of the deadliest outbreaks of COVID-19. It had a cockroach problem. It was outdated in its infrastructure with narrow hallways, no outdoor space. I guess, as far as the minister is concerned, a home under those conditions under the NDP would remain open. It wasn't a good place for seniors, and I think that's been acknowledged. So I don't think the minister's being entirely when those beds were closed. I certainly wouldn't want my loved one in a facility that was the subject of a licensing review with a persistent cockroach infestation, inadequate recreation programs. That's not what Manitoba seniors deserve. But getting back to home care, the minister talks about the decision that their government made to centralize home care scheduling services and still has not clearly answered the question of whether those scheduling services are still centralized in downtown Winnipeg. That was a decision made by the N-Care staff and home care clients in Winnipeg, and they still have not answered that question. So I'll just ask again, are home care scheduling services still centralized in downtown Winnipeg?
Thank you, Member for Roblin. health, seniors, and long-term care.
Thank you, Honorable Chair. I'm just waiting on some information for home care that I can provide for the critic. But I do want to talk, I think it's so fascinating to hear her talk about the conditions at a personal care home, which I don't know if she ever had the opportunity to visit. I certainly did. Like I said, I did the staff. We advocated for the conditions to be addressed. The previous PC government had 2 terms of government to address those conditions. 7.5 years of that personal care home. I mean, I know folks who actually worked at that personal care home much longer ago than that. But she talks about the conditions at a personal care home for 7.5 years. I agree with her. I think those conditions were unacceptable, which is why we advocated for them to be addressed. And not only did they go, that personal care home was then shuttered, and there was no work done to build more capacity so that we didn't displace those folks. And in addition to that, we lost 185 units right downtown of social housing that many seniors lived in. I remember sitting with a senior in Lyons Place, I'll never forget this, sitting in his living room with him, who cried because he was so afraid that he was going to be made homeless because he lost his housing at 185 at Lyons Place and thought, my goodness, you know, they closed that place, they're selling off this one, what's going to happen to me? And I was grateful that Asolv was able to use the makeup of that building. And so it's not just strictly senior housing anymore, and the infrastructure they used to have and the amenities have changed. And if you go there at Lyons Place, it is a community. It's absolutely 3 years old now. She runs that place. You go talk to Richard. He's the person who brings all the residents together to advocate and have social gatherings and whatnot. Like, all of these places are communities. A personal care home that had conditions that were unacceptable for 7.5 years under a previous PC government. And then to not acknowledge that not only were those conditions allowed to persist, personal care home capacity, I just think it's a strange thing to raise in this committee, to emphasize that failure of the previous government in this committee. Making sure that we have more capacity, and I'm gonna be honest, like, there's a lot more personal care home capacity that we need in Manitoba. We are building one a year. We've got Lac du Bonnet, we've got Park Manor, Bridgewater that we've announced. We know we're doing Arborg. Like, we've got these PCHs that we're going as quickly as we can, in addition to transitional care unit homes. We've got Holy Family doing more potentially there, and other places as well. We've actually also reopened personal care home beds that were closed under the previous government due to staffing or other infrastructure needs, prominently in rural communities. Those are about 222 beds that were closed by the previous government and neglected, and we've reopened at this point. I believe it's around about 150 of those beds have been reopened. Our target, at times are closed due to an elevator needs to be changed, or there's something going on that needs to be fixed. But we're doing a ton, and we've got some more innovative steps that we're going to be taking. But again, all of this work is that much more urgent because the work was not only done previously, was only not only not done, but I'm happy to talk about our investments in long-term care and what we're doing. But I think it's important when we reflect on the past to reflect on who was responsible and why we must do better moving forward. And I'll get some.
Thank you, Minister. Member for Roblin.
Well, I find it interesting that the minister brings up Lyons. I think they were talking about housing, but Lyons also last year stopped admitting new residents because this minister wouldn't meet with them to discuss their concerns. And that represented a loss of beds. They refused to work with the sector to address their growing concern. And their concern, of course, is that funding has not kept pace with inflation, and funding have been in place to cover government negotiated wage increases that operators have no control over. And in Winnipeg, actually, the funding provided to operators doesn't even cover the cost of benefits. It's the actual cost is 22, so operators are left to make up the shortfall. But I do want to go back to the question that I asked about the Stevenson funding and why that funding budget documents. The department has a goal of working towards more hours of care per resident day. I don't think that's going to be possible without funding. What happened to that Stevenson funding that stopped at phase 2 after the NDP took office?
Thank you, Member. Honorable Minister of Health, Seniors and Long-Term Care.
Thank you, Honorable Chair. You know, the member reflects on, and when I will say the Golden Door person to be open, we ensured that those beds would remain accessible for Manitobans, which is why we took the extraordinary step of expropriating that personal care home. We took actions that the previous government refused to Manitobans. So challenging situation, we knew we needed to make sure that we addressed it. We took action. So I appreciate the member highlighting actions that our government has been willing to take that the previous government was. I appreciate her emphasis on funding for long-term care. It's an important one because funding to long-term care does matter. And our government has ensured that those dollars for staffing continue to flow. Direct hours per resident per day have increased significantly. We invested $40 million into staffing. Our first budget, the budget that we came into actually was about a $11 million cost that was allocated for staffing to get to that 3.8 funding. We flowed dollars to staff. We said staff as much as you possibly can in long-term care, and folks really did an outstanding job of staffing long-term care. So much so that I had to go back and much more money because they well exceeded that budget line. To the tune of about $40 million is what we actually have invested in our last budget, and we've carried that forward care homes. So they've done a tremendous job staffing so that we can increase those direct hours per resident per day. And the outcome has been really, really good to see in terms of, you know, you go to a personal care home now and you actually see workers. We're having conversations about rec workers, spiritual care workers, folks who lost their jobs under the previous government because, again, as the member rightly notes, funding mattered. Under the previous government, years of zeros. And actually in 1 year, right before COVID, I mean, all these other zeros are cuts, we know that, but 0.2% in 27-18, negative 0.4%, 2018-19, 2019-20, 0.2%, 0.1%. We're talking about, at that point, given everything that was going on in long-term care. And still, 0.1% de facto cut, especially after years of zeros from the previous government. So, our government is investing in long-term care. And when we compare our record, yes, a rapidly aging population, yes, a population that is growing in number, growing in complexity of healthcare needs at later stages in life. When you look at zeros of information that we have, they knew the population was aging rapidly. They knew that people were getting much sicker and living longer. They knew the complexities of what they were dealing with. They knew about the pressures. They knew long-term care needed more help every year, including during COVID. We're going to keep investing in long-term care, but certainly when you hold up our record against theirs, we got to be in the challenging situation that we're in, and how much work our government must do to make sure that seniors are able to age in their place of choice with the dignity they deserve. Slow down. We're not going to take our time away from this. We are focused on making sure that seniors in this province consistently have a government that's investing in their well-being. It's why we're investing $5 million in this budget dedicated for better nutrition in personal care homes. It's why we go to personal care homes and listen to the staff and listen to the residents themselves. Against the PCs in black and white, it's pretty plain for Manitobans to see who actually cares about seniors and who's willing to invest in seniors.
Thank you, Minister. Member for Roblin.
I just want to reflect on how disappointing it is that all the minister wants to do is sit in committee here and engage in partisan attacks and partisan debate and opportunity to showcase the things that they say they're doing under their government. I've asked twice now whether the Stevenson funding has continued to flow. I hasn't been able to point to where in the estimates of expenditure that funding is. So I'll take that as asked and answered now. I do have a question about we know that Manitoba's led the country in food inflation, and certainly long-term care operators have felt that, as food is one of their significant cost drivers. So 1,000 per PCH, and I'm just wondering how that funding will be distributed. Will it be distributed sort of on a per resident basis, per facility basis? Is it going to ask a straightforward question about something their government is doing? So I'm hoping we can just get a really straightforward answer instead of a 5-minute partisan diatribe. Thank you.
Thank you, Member. Minister of Health, Seniors and Long-Term Care.
Thank you. My answer in what she calls a partisan diatribe. The way that I articulate myself has been described in other ways, but I'll accept that. But I did say yes, the funding mistake, and the funding continues in order to make sure that the direct hours per resident per day continue to get to the target of 4.1. And actually, what I would say is that our government understands that 4.1 when I worked in long-term care. So when I was working in long-term care in community, that 4.1, it was like 3.9 for a while, then it was 4.1. There's a national consensus around that. evaluate going beyond that. 4.1 has really become the floor, not the ceiling. So there's work that we're doing to understand, what does that new target need to be? How do we invest in supporting getting there? Staff, particularly when we're talking about work around nurse-to-patient ratios and that conversation. Lots of work in that space right now. What I can also say is that big investment as a first step in nutrition for seniors in long-term care homes, because we've been hearing, and we are a listening government, we've been hearing from operators and from residents that we invested, and we announced this at the Simkin Center, $5 million rather for nutrition dedicated to that, as the member has asked about. And what I can tell her is that thank our partners. So Marsh, LICAM, these are wonderful seniors organizations that have been advocating for those in long-term care for many years. They've been very, very for their support and their acknowledgement of that investment as a meaningful step in a much better direction in terms of making sure that elders have the nutrition that they deserve and the choice that they deserve. Makes a really big difference. We have an incredibly diverse province. We have seniors of many identities aging in Manitoba, and when they choose to live in the kind of nutrition that aligns with them culturally, spiritually, physically, and this investment is a step in a direction that really supports that. And so the work is being, they are able to use those dollars in a way that is most impactful for them. And again, this is a first step. This is a step that we haven't seen taken in this particular, like this was made in terms of nutrition in long-term care homes. But again, our government is committed to making sure that when advocates, when our partners, when seniors are speaking up, that we are listening. And I just want to give a shout out to my legislative assistant, the MLA for Radisson, who is a stellar MLA, but also somebody who just does a great job with seniors, hearing their stories, bringing their concerns back to me and making sure that we act on those ideas and hopes and concerns that they have. Alongside also, I want to acknowledge the MLA for nursing culture, who also goes to nursing homes, seniors, personal care homes rather, apologies, and connects with folks. And actually, quite frankly, like our team is really good at getting out in their meeting for their community members. So, we were at Simkin that day because the MLA for Tuxedo, the MLA for River Heights, they both have built great relationships there. It was a great place, a community auntie was there that day for her day programming on a Thursday. I saw her on the weekend, and she said that she was really thrilled to see us there for that reason. So I know I need to go back to Simkin on a Thursday. And all of that to say, we're going out, we're listening to folks, we're showing up, and we're making investments as a result of those conversations. And I can't thank my colleagues enough. They do a lot of the heavy lifting in terms of getting out and talking to folks. Homes enough. They've been advocating for these investments for a long time. These operators have been advocating for a long time. So we're going to keep doing what we can step by step in partnership with these organizations, with these.
Thank you, Minister. Member for Roblin.
Thank you, Honorable Chairperson. I'm going to shift gears a little bit, and I just want to talk about at some length on page 37 of the supplement. It's listed as one of the key initiatives of the department, and we know certainly the current government had promised to hire first term, 90 in their first year. Both of those goals look out of reach at this point. Certainly the first year commitment was not met. But there's been some and I'm wondering if we can clear that up today. So first of all, the government said that they had hired 241 net new paramedics. That was an error and was later revised to 18. Some shared health data last month showing a net loss of 34 paramedics. And then I think it was yesterday in question period where the minister said there has actually been a net gain of, I guess my first question is, can we clear up these numbers? And I'm wondering if, when the minister cites the number of net new paramedics, if they can explain where they're located.
Thank you, Member for Roblin. seniors and long-term care.
Thank you, Honorable Chair. I'm just waiting on a bit more information, but in the meantime, I can provide a bit of clarity, I think, for what the critic is asking about. This is a priority for our government. Certainly, we set very ambitious targets across the board in terms of what we want to do in healthcare, in hiring net new healthcare workers. You'll know that we've blown out of the water, but that's okay. That's okay. Accountability is important, and the critic is correct. We have not hit our targets on net new paramedics, but we also recognize the way that infrastructure to train and retain paramedics in a timely manner had been eroded. It had been cut, slashed for years. I mean, paramedics went almost 6 years without having, were working without a contract, as were nurses. That really damaged the morale. It damaged the integrity of the system's ability to recruit paramedics and attract folks. Who would want to be a paramedic in Manitoba where your government doesn't respect you? That was the narrative. Paramedics were telling each other, this government doesn't respect you, they're not going to pay you fairly, they're not going to bargain fairly, they're the advanced care paramedic, they won't even let you get a job in rural communities where you can really maximize your skill set. So, a lot of folks were just turned off and turned away from the profession as a whole. And so our government came in and we do here to change the narrative around that. And so, ensuring that there is a fairly negotiated agreement was a really important step, and an agreement that actually brings paramedics to successfully and more competitively recruit people to rural and northern communities. That was a really huge step to take. Now, the other step to take was making sure that we are adding more training seats. Again, government, and the training seats that were there were not full because people didn't want to pursue it in that environment. So we added additional training seats. We have funded training seats so that folks they're training in a more accessible way. And we funded advanced care paramedicine training seats as well, 16 of them actually. And we created jobs in rural communities for advanced care paramedics. So to build up the capacity and the infrastructure for paramedics in Manitoba, because it had been cut and ignored and neglected for so many years. All of that we're at now, so the most recent number that I've been given and provided is 41 net new paramedics. This is a number, wasn't just yesterday in question period, I've been saying that now I think for a couple of weeks. And it's that number has been explained to MAHCP, so my special advisor sat down with them before our budget was introduced. At that point it was 29 net new of that number, and now we've gone up to 41. It's also important to recognize, we have the first full class of paramedics in Manitoba in many, many years. I have been there several times. The Premier was there. On social media of me running down the hall and high-fiving all these paramedic students in the hallway. I was pretty excited to meet them all. I think they're pretty happy to see a government there supporting them and learning about their training, who's been a phenomenal partner in getting these additional training seats up and running. And it was also really cool to see the 18 learners who are part of the direct entry pathway to paramedic training now. Infrastructure and a better process to get more paramedics trained. And for the first time in many years, we have a full class of paramedics who are going to be joining our healthcare system and joining our communities. So work for us to do to get there, but we're working with our partners to build that capacity. And I want to give a special shout out to AMM. We have been working with municipal leaders, with our municipal partners to do this, of what they want to see in their rural communities. And it's thanks to their leadership, and it's thanks to the advocacy and the leadership of someone like Kathy Valentino and all of these other representatives that for the first time ever in Manitoba, rural Manitoba, they have jobs there. So more work to do, we recognize that. But these are good steps in the right direction.
Thank you, Minister. Member for Roblin.
Thank you. Can the minister confirm those 40 of paramedics and EMRs?
Thank you, Member for Roblin. Honorable Minister.
Thank you, Honorable Chair. I'm just waiting on some information for the member in terms of answering that question. But I do want to flag that in April, just going back to 2023, the home care cancellation rate was 3.62%. The cancellation rate, which we are not happy with today, we know we need to do better, is 1.2%. Of course, that 1.2% represents people who are rightly frustrated about their cancellations. They're rightly frustrated about the level of consistency around the care, everything we can to make sure that we continue to move in the right direction in home care. We're improving staffing. We've hired more direct service support workers, nurses. We just had actually our first happen for 2 terms of the previous government, and we hosted this in Union Station. Yes, there's a bit of a bias there because I'm the MLA. Maybe I really wanted to host it in my neighborhood, but to get to. And we hosted this job fair. We had, over a couple of hundred people register in advance. We had 200 and show up on the day. We did interviews on site. And as a result of that, I can tell you that we had about 40 jobs accepted after that, which is really wonderful. Like these folks, for different reasons, showing up and talking to a person in real time can make all the difference. Some people like virtual, some people like the phone, some people use all kinds of apps to communicate. A lot of folks, including myself, prefer. Out of that number, 22 are nurses who are working in home care imminently. Like that is, out of one event, we hired 22 nurses for home care. And again, we need to show you that if you're willing to do things a little differently as a government, you can get results. And we've got wonderful people at our retention and recruitment office. These folks are absolutely stellar. They're great human resource. They're passionate about connecting people to job opportunities and making sure these pathways are clearly understood. And they just create a space where people can feel comfortable to ask questions and get their needs met. And it's why we're seeing cancellation rates in home care go from, under the previous government, 3.62% in April, to now 1.2%. And again, our target is to get that under, and then also do the work of restoring services in home care that were cut and eliminated by the previous government. And I have a constituent named Michael. He's a wonderful, wonderful guy who depends wheelchair bound. And, I remember he would reach out to me years ago now that the services that he was receiving around laundry support and other things were being rolled quality of life on a day-to-day basis in his home. So when we're talking about home care, we also have to recognize that it's also about the comprehensiveness of that program. We also recognize that we need to build up that capacity with our regional health authority partners in the north, the Interlake and Prairie and Southern. So that work is ongoing in detail. And again, when we're talking about paramedics, they're often responding to people. We've got our wonderful MLA for Waverley here who knows all about it, a wonderful teammate and colleague who, in terms of the realities that paramedics face in our communities. And we know that they're sometimes responding to people who haven't gotten the right care in their community. So by investing in the ways we are in home care, by bringing that to our EMS services to make sure that they can focus on delivering care elsewhere, and also pressure off of our emergency departments. So this is all connected, right? So I wanted to make sure I shared that stat to have on the record here today. And then in terms of EMS, there's a lot more I want to say about what we're doing on that particular file. I want to thank the paramedics who I've been sitting with and talking with, but I'll share more in my next response.
Thank you, Minister. Member for Roblin.
Thank you. And I just want to name the behavior we're seeing here today. So I'm asking questions on behalf of Manitobans. One question that I've answered, and we've been in this committee for an hour and 40 minutes, and they choose instead to spend each 5-minute segment just talking about not answering the questions. And I had hoped we might be able to close out health today. We will not be closing out health today because we're not getting answers to the questions that we're asking. Again, to paramedics. According to MAHCP, which would know, rural vacancies of advanced, intermediate, and primary care paramedic positions have actually, as of December, vacancy rate was at 25%, up from 14.8% 2 years ago. So MAHCP has proposed some solutions, including mentioned AMM. They have also suggested paid training could be a solution to this. So I'm just wondering if there's any consideration in Budget 2026 for either of those proposals.
Honorable Minister of Health, Seniors and Long-Term Care.
I love talking about healthcare. I love it, and I'm passionate about it. Our whole team cares about it deeply, and I will always provide context and information and details that Manitobans deserve to know. Manitobans deserve to know the details. They deserve to have the information, and committee is our opportunity. I recognize that some of the information I'm sharing is probably somewhat of an irritant for the critic because it reflects on the previous government's failings in healthcare. But it's important information for me to talk about what we're doing to fix healthcare. And you know, the EMS conversation is a really important one. When I sit down with Reeves and mayors, municipal leaders, community members in rural Manitoba, colony leaders in rural Manitoba, they make very clear to me that the conditions right now, we agree. We need more EMS capacity across rural Manitoba and northern Manitoba, which is why we've ensured, and it is outlined in our budget on page 36, that we can train and retain more EMS providers in Manitoba. So just as an example, the EMR pathway, the EMR program, something that we're advocating for years. They've been asking for this, saying that we need a more accessible way for folks to get their foot in the door in this career choice and then skill them up to paramedic. Just awesome. When we were out in Souris, Manitoba, and she talked about how she started her career as an EMR and then became a PCP. Just a fun. And so we were able to take that step with our partners. We finally have the EMRs that can work in Manitoba. Now that training has been reinstituted. We're working with the college to make are reflective of what community needs in terms of getting them out in a timely way. And we, you know, following the addition of up to 60 EMR positions, we created a $1,000 bursary for a 1-year return of service. Like those are real dollars for folks to become an EMR, have a guaranteed job, and then again, get skilled up to becoming a PCP. PCP pathway formalized. We're excited to share more on that soon. But we are investing in making sure that we've got these folks in communities as quickly as possible. We're looking at some numbers here and trying to pull that together, but I can tell the critic in regards to the makeup of the EMS numbers, the 41, that is ACPs, PCPs, because EMRs are very recent, that would be a low count for right now. But we've got cohorts of training for EMRs happening right now in Manitoba, which is really exciting because, again, this is in conjunction with the direct entry paramedic seats we've added that are now full and the jobs that we're creating in rural Manitoba. We've been able to, as a result of the work that we've done, Manitoba, which is great. That means that folks can engage with paramedics in their communities before needing to go to a hospital or an ER or something more acute. And we want to see more of that model rolled out right now. So that's why we're doing everything we're doing around training more paramedics, getting skilled EMRs on these ambulances, and then skilled up to becoming PCPs. If that's what they choose, that would be really great too, because those folks are highly, highly skilled. So again, we've done a lot to get to this net new 41. At this point now, you know, we anticipate being able to see that number work of establishing a strong foundation in training and you know, packages to retain people and recruit people to the front lines. Again, there's a lot more work to do here, but we're going to keep moving things in a better direction.
Thank you, Minister. Member for Roblin.
Thank you. And certainly EMRs have but I think one of the concerns that MAHCP has raised and what they have said is that Shared Health is choosing not to hire qualified paramedics for some open PCP position. And they were concerned about that. They also had made a suggestion, you know, regarding the $5,000 bursary for EMRs to skill up. That's a suggestion that the province require EMRs to enroll in a PCP program within a specific period of time. So I guess how many EMRs have been hired into PCP positions, I guess is what I'd like to ask.
Thank you, ma'am. Honorable Minister of Health, Seniors and Long-Term Care.
Yeah, I want to thank MAHCP for their advocacy on this particular issue. I'll just name it. They've had big frustrations with shared health. Actually, I would say a lot of folks, particularly in rural northern communities, have had a lot of frustration with shared health. It was an organization murky, couldn't get a sense of what was going on in that organization, who was responsible for what, who was accountable to what, and we've done a lot of work to better understand shared health and what's going on there, who bring valid concerns forward, and then we work to address those concerns with shared health. I want to thank Dr. Chris Tadulu, who is the interim CEO of that. We've been working tirelessly to address those concerns and to build good relationships with partners across the province. And, we've been working closely with him to ensure that those concerns are addressed. But I want to thank MAHCP for highlighting their concerns and for bringing forward ideas. We welcome ideas. We welcome solutions. We will always take that feedback and see what can be done, how ways possible. Certainly, we really, really want for EMRs to choose to skill up if they have the capacity and the desire to becoming full PCPs. We're going to support them, dedicated pathway for that. And we've given the direction to Shared Health to say, listen, identifying these folks very early on and making sure that they are connected immediately to that pathway is important. Folks who don't want to become PCPs, perhaps it works for their lifestyle, whatever it is. And so we want to make sure that they are highly skilled EMRs and that they can spread the good word about that. It's really positive so we can get more folks on track to becoming paramedics. So that direction has been given in terms of ensuring that we are doing the work of facilitating those development and their contributions to our healthcare system. I also want to recognize here that this is all work that's been done in the last matter of months, like the last year or so, really, working with our local community partners. But this is all work that we've been working with them quickly to do because it wasn't done for 7.5 years, right? We would have been in a much different place. We would have, a program established of EMRs, training, pathway to PCPs, ACPs who can get jobs in rural and northern communities. We're in a place where we're standing this up now, and so that they can ensure that the program for EMRs is a model that works best for communities. That model changed under the previous government. And services, EMS services in communities that have eroded because they don't have the EMR pathway any longer. And that was really accessible, particular in First Nation up this kind of service and had well-established pathways that worked for their communities. So we've now been able to get that reinstated. We are working with the college at the request of First Nations and Northern partners to ensure that program is a model that works best for those communities. And that work will continue. We're hoping to see some outcomes from, we want to make sure that we're doing everything we can to encourage folks to join healthcare. It's a great career. It's a wonderful field. We've got several healthcare workers in our government's caucus career, and one that lends itself to many other opportunities of public service. So when I go talk with those students every single year, the minister of share with them the opportunities to get that letter of offer in their hands before they graduate, so they're connected to jobs. And we're really excited to keep doing that work so that we can continue to see these full seats. And I'm happy to share that, for the first seats, right? And so the EMR program is great too. We can give folks another option to joining that pathway for a career.
Thank you, Minister. Member for Roblin.
Thank you, Honorable. Gears a little bit and ask a series of more policy questions that may or may not be addressed in this budget that have been brought to my attention by would raise these issues in estimates and ask the minister directly about the department's intentions with respect to these policy issues. It's not casework specifically. One of those feels a little personal to me. I actually just on Sunday attended a celebration of life for a good friend of of mine and my husband's who passed away in January from colorectal cancer. He was an ambassador for Cancer Care Manitoba, just a wonderful human being. I think he would want me to ask this question. And certainly the Canadian Cancer Society has been routine screening for colorectal cancer. I know a couple of other provinces have moved in this direction. So I guess I would just like to ask if there's any consideration in this budget or any plans to cancer in Manitoba.
Thank you, Member for Roblin. Honourable Minister of Health, Seniors and Long-Term Care.
Thank you, Honourable. That's really sad. It sounds like your friend was obviously quite young as well. So that makes it, it's a hard loss at any time, but certainly when folks are young and pass, that's incredibly difficult. So I'm sorry for the loss. Not super clear on the protocol, Honourable Chair. It's not specifically in the budget. It's not an estimates question. However, I'm happy to answer it if that's permissible.
Honourable Minister of Health, Seniors and Long-Term Care.
Thank you, Honourable Chair. Screening saves lives. Early screening and early detection saves lives. We know that. And we spend a lot of time talking about screening as a government. We ensure more Manitobans understand screening, particularly in the breast cancer screening space. However, very recently, actually this week, I think maybe folks will have seen, I shared on social media a Cancer Care Manitoba regarding colorectal screening. This is something that we know. It's actually, if you've ever had the opportunity to see a mobile breast cancer screening van, and colorectal screening is one of them. And they have that there to generate awareness. They used to do some form of that screening there. They don't have it fitted right now for that, but they do make it really fit tests and access the information regarding that. So, we've seen that other jurisdictions have lowered the screening age for colorectal cancer screening. We've talked happening. We are in active conversations with them about what that could look like in Manitoba. What is their recommendation on this? Similarly to breast cancer, it's you just lower the age and then that's that. There's a lot of work that has to go into making sure that you've got the right capacity and the infrastructure, the people, all of the tools that we've initiated those conversations with Cancer Care Manitoba. I want to thank Dr. Stobart, who is the CEO, who's doing a phenomenal job. I want to thank Arlene Wilgosh, I thank Dr. Turner, who was the acting CEO for some time, and is just a phenomenal leader over at Cancer Care. Very responsive to us, wonderful partners to work with. Cancer Care is obvious, and all of us in some way, shape, or form are affected by cancer. We have loved ones. It's either ourselves or community members. We're all affected in some way. We're getting the information out there, generating awareness, and eliminating barriers to accessing screening. So I would say one of the first things that we need to do actually is to work with what more must be done to ensure that those who are eligible understand how to get access to cancer screening. And actually there is, if you go to Cancer Care Manitoba, it's cancercaremanitoba.ca/screening/info, and you can get all the information on how to get screened. So screened, early detection, early screening does save lives. So there's a lot of work we are looking at in this space, in addition to other areas as well, including lung cancer screening. That's something that we know marginalized communities aren't getting screened early enough. So there's also work that's happening in that space as well. So big area of priority. I appreciate the question from the critic.
I appreciate the answer, genuinely. Thank you. I do have a couple of other questions, and I'm trying to find the budget line that this would refer to, but it would be a couple of different medications. And this isn't a partisan question because, this has never been covered in Manitoba under any government. in receipt of some letters of advocacy. I know the MLA for Radisson has also met with these folks who've been advocating for covered. And I'm just wondering if there's any consideration in this budget for covering those medications. What I don't know, I'm wondering if the department has done any work on that to look at what that cost would be and if it's feasible in this budget year.
Honorable Minister of Health, Seniors and Long-Term Care.
Thank you, Honorable Chair. Can the critic clarify, is this a broad question about education that she's asking about that she'd like some clarity on?
Thank you, Minister. Member for Roblin.
I'm going to have to look up the name of the drug. Injection medications for transplant recipients. There's been some advocacy from a number of Manitobans looking to have these medications covered by Manitoba Health in Manitoba, but I understand they are covered in some other provinces. So if the minister wants to look at that, I will look at finding the name of the medication.
Minister of Health, Seniors and Long-Term Care.
And the critic is correct. We've been receiving advocacy on this, and I want to thank those advocates. We know that life-saving care, like the transplant program, our ability to deliver that care in Manitoba has grown, which is a good thing. We still have relationships with other jurisdictions for transplants that we can't do in Manitoba, and relationships and the care they're able to provide to Manitobans when it's out of our scope. This is an issue that, yes, the MLA for Radisson has been. members of community who have been bringing this advocacy forward. And, she's done a great job of helping myself better understand their concerns. The critic is correct. This is a long-standing policy reality in Manitoba. We are doing work in this space. We are taking a look really at what potential options there are available. Scan and environmental scan is being done to understand what the practices are and why. And in Manitoba, there's obviously a process in terms of how drugs land on the formula. Medications, in particular, I believe for the most part, are pharmacare deductible specific. And so we are taking a look at this because we know that who have received a transplant are in a pretty vulnerable time health-wise. It's really important that they're able to recover and have what they need in order to do so. And so, anytime Manitobans speak up about concern, ask us to take a look and see, if and what can be done, we're happy to do that. So our department is taking a look at this, looking at the work that's happening in other jurisdictions, and we'll continue to meet with the local advocates for a live part of the conversation and the work that's being done at the department level.
Thank you, Minister. Member for Roblin.
Thank you for that answer. And regarding coverage for a particular vaccine, there's been a significant amount of advocacy lately around the shingles vaccine. And I know fairly costly for Manitobans to get the shingles vaccine as they pay out of pocket. But shingles itself is incredibly painful. A lot of doctors recommend to their patients, I think once they start hitting about 50 years of age, that they get the shingles vaccine. Just as part of the budget, that's something that Manitoba Health would begin to cover. But I'm just asking if there's any consideration in this budget for beginning to cover the shingles vaccine, and that the department could consider where immunocompromised people or an income-tested way of doing this. I just wonder if the shingles vaccine.
Thank you, Member for Roblin. Honorable Minister of Health, Seniors and Long-Term Care.
I do want to just go back and highlight some of the folks who the MLA for Radisson has been meeting with, who are incredible advocates for the anti-rejection transplant medications, who is actually a Union Station constituent, and really appreciate that we've got a voice in Union Station who's a part of this advocacy conversation. We've got Kristen, who's a Radisson constituent, Barb, who's a Radisson constituent, and they've been meeting, and the MLA for Radisson's been meeting with them to learn about their experiences. And there's a direct quote from someone here that says, "There is a whole journey after a transplant happens." Really, really powerful, right? It's a whole other experience post-transplant. And so we're taking a good look at what we can do here and better understanding this space in Manitoba. It is important to know this for the critic, but I've been advised that there was once coverage in Manitoba that was actually cut by the previous government specifically for low-income Manitobans, which income folks no longer benefit from that. So we're taking a look at this overall and seeing what can be done. But in regards to her question now, just want to make sure that I can touch a bit on some of those details. Okay. So we have, actually the MLA for Tyndall Park has been a really great advocate for shingles, and I want to give her a shout out because I know she's busy right now, very busy probably. Her second baby, I hope, is doing very well, and I hope they're very healthy. But she's been a really great advocate for this in communities, and our government has been listening. So we do have a plan in terms of vaccine. As you can imagine, we've really expanded the way that we deliver vaccines in Manitoba. We've allowed for more people to provide vaccines in Manitoba. We have extended, which is really, really great and really necessary. We introduced RSV coverage for seniors in personal care homes, with more to come on that. Measles, obviously, is a vaccines. We believe in science. We stand with science. We trust our experts. We follow their clinical guidance and their expertise. And there's been new and emerging evidence that suggests a vaccine can help mitigate some of the impacts of Alzheimer's. It's more recent research that's emerged. I think it's really important to pay attention to, and we are. Alzheimer's and dementia in our communities, which is enormous, and the impacts on people and families and on our healthcare system. It's really important for us to make sure that we're live to that research, that data. We have a plan for the shingles vaccine. We'd like to move on it much more quickly, but obviously, that, and we're going to if we can, but we don't have a clear timeline just yet. We are a province. We have done a lot to enhance coverage of vaccines in this province and care in this space. We're doing this in a fiscally sustainable way, and up to speed in terms of when we hope to take that step. But I want to thank all the seniors who certainly talk to me on a pretty regular basis about concerns around vaccines, whether it's RSV, measles. Seniors are the folks who built this province. They want to be protected. They want this province to be as healthy as possible, and they recognize that vaccines are a part of that, and so do we as a government for Manitobans when we have it.
Thank you, Minister. Member for Roblin.
Thank you. A constituent brought to my attention the testing, and if you go back and you look at the publicly posted wait time statistics for bone density testing, the wait time has gone up consistently. The most recent posted wait times are for February, and in February 2025, the wait time in Winnipeg was 11 weeks. It's now gone up to 26 weeks and actually more than doubled. So I'm not sure the reasons for that, but I would like to know where in this increased capacity for bone density testing to address this very steadily increasing number of people waiting for a bone density test.
Honorable Minister of Health, Seniors and Long-Term Care.
Question that the critic has raised. Bone density testing is incredibly important. Obviously disproportionately affects women of a particular age as well. We're learning of what's happening with their bone density and in their bone health, so that we can prevent, experiences like fractures and things like that. So, which can have really, almost catastrophic impacts. So, what I can tell the critical, I'm waiting for some information. So I'll just talk a bit about the diagnostic space. One, in terms of the volume, what I would say is that we have more providers in Manitoba. We are hiring record numbers of physicians, and so we're seeing an increased pressure on diagnostics. We absolutely recognize that shared health capacity in the diagnostic space. Dr. Socorro is our provincial lead for diagnostics in Manitoba. We've met with him many times, including in conjunction with advanced education and training, because there's shared responsibility there in terms of when I first met with him, he made very clear that he was kind of really just on the edge of his seat, waiting to get a mandate from government to say, go ahead and develop folks that you need in the diagnostic space. He had never been given the direction or the mandate from government before. Hadn't been given the resourcing to do that. And so Manitoba, for almost 8 years, diagnostics in this province, which is a huge concern because, as the critic will know, these are highly specialized folks. And you have to have a capacity plan in place to make sure that people who can order diagnostics, that you are in conjunction with that developing the capacity plan for the people who are going to be responsible for delivering that care directly to the patients. Education and training to ensure that we are training more people for these opportunities. We've actually taken the step to buy additional training seats in other jurisdictions. We are buying seats in other jurisdictions with our partners so we can get folks trained in the province with a return to service agreement in place. So we're really kind of attacking this issue from that's the fundamental lack of capacity because it wasn't addressed for years. And we want to make sure, Manitobans deserve to be able to access these kinds of services when they need health. We know that. And we know that we need to do better here in Manitoba. And so Shared Health has been given the direction to ensure that there's an immediate but also a long-term plan. We have capacity where it needs to be, and to improve the timeliness at which people are getting these tests done. Whether that's high or doing better than, but Shared Health is responsible for diagnostic services and imaging in Manitoba, and we've been very clear with them. We meet with them to reinforce the direction that, and to recruiting, developing strategies to get folks where they need to be, so that folks can get care in a much more timely way. So that work is going to continue. We've already made some changes of these jobs and specialties more accessible, more expedited, so that we can get folks on the front lines more quickly, recognizing that with more providers in our on diagnostics.
Thank you, Minister. Member for Roblin.
Thank you, Honorable Chair. And, the question was about bone density testing specifically. I think it's important to note that diagnostic wait times have increased substantially almost across the board, whether we're talking about MRIs, CTs, all three diagnostic tests that we track and measure publicly has gone up, and the number of people waiting for those tests has gone up. And I think that's something that's probably that tends to be their go-to strategy when I ask a question that's difficult, is to blame the PCs. But these wait times are increasing significantly right now. They've gone up, and there's really nothing that the minister can do to attribute that to a previous government when it's happening right now under their watch. Is very important. As I mentioned, this was raised with me by a constituent who was waiting months for a bone density test. And the same, waiting for an ultrasound. So again, I rather than just looking backwards and blaming other governments, I'm wondering if the minister could point to where in this budget there's an emphasis on in this province and how they intend to do that.
Thank you, Member. Honorable Minister of Health, Seniors and Long-Term Care.
Yeah, I'm just waiting on critic on this, so I thought I would talk a bit more about what we're doing in the diagnostic space and give a shout out to Melita. We were out in Melita, and we met some really wonderful folks there who explained to us that they've got cross-trained lab technicians there. One in particular, whose name is escaping me right now, but she was, and they were explaining that what's really worked for them is identifying folks in their communities and securing a training seat and having that relationship directly from her. She's like, that really worked for me. I love my job. I love what I'm doing here. And I want to see you folks do more of that. We said, absolutely. Like, we can do that. And we took that away, and we in Saskatchewan, and we worked directly with our municipal partners to identify folks from their communities who they knew wanted to pursue these opportunities and that they have a guaranteed job once they're done in their home communities. And so this is a partnership approach. It's a collaborative approach. It's one that we know, it's a grow your own approach. It's one that we know works. And it's forward, again, as we build up that capacity in terms of being able to train folks in these ways, more specialized diagnostic areas in Manitoba, that work takes time. Wasn't. And so we're doing the work of standing that capacity up in Manitoba, at the same time purchasing training seats elsewhere so folks can get trained, connecting them proactively to communities where providers, and also getting the plans from Shared Health in terms of how they intend to address these wait times that are unacceptable, and that those plans can be executed for Manitobans. And so, we'll continue to invest. We've, $10 billion budget this year. Year over year, we've invested in healthcare to support the healthcare system. And, again, as we add more providers to our healthcare system and as more people have access to primary care, which is a very good thing, we also know that we need to strengthening and bolstering diagnostic training, retention and recruitment capacity as well. So that work is being done. And we know that there's much, much more work to do. I look forward to seeing their updated plan and approach in terms of how we're going to drive some of those concerning wait times down in a better direction, and how our government can continue to invest in this area.
Thank you, Minister. Honorable Member for Burroughs. Honorable Member for Roblin. Sorry.
Thank you, Honorable.
Even he disagrees.
Our Honorable Chairperson has been chairing many committee meetings lately, so I could absolutely understand the slip of the tongue there. Our agreed upon time to do this today. So I have a number of additional questions for the minister and the department. I'm a little disappointed in how the conversation went today. Didn't hear a lot of answers to the questions that I posed. And I think folks, when I send them this Hansard transcript later, and I say to them, okay, I asked that question on your behalf, and I pursued that issue, then the Minister of Health. That instead the minister preferred to lecture me on the previous PC government, and rather than talk about things like record high ER wait times and hospitals that are gray listed in multiple, a concerning number of hospitals in the long-term care sector, extremely lengthy and growing diagnostic and surgical wait times. We didn't get to surgery yet, but we have a concerning number of surgical cancellations at major hospitals in Winnipeg. We didn't get a chance to talk about how I was surprised to see that this budget didn't include any movement to ensure Manitoba was in compliance with the federal government's interpretation letter. And Manitobans' disappointment that equivalent services provided by a nurse practitioner, and what a missed opportunity that is for Manitoba and for Manitobans to better and more fully incorporate nurse simply by modernizing the funding model.
that would provide, we talked a little bit about access to primary care. Nurse practitioners are part of that solution.
Please, the hour being 12:30 p.m., committee rise.